Good health. It's all about balance and staying in tune with your body. But intuition isn't enough. Having regular screenings is vitally important to your long-term health. And now, the latest advances in diagnostic technology can be found in a beautiful, relaxed atmosphere. Introducing our all-new Women's Pavilion, dedicated to the healing arts and clinical needs of women. St. Tammany Parish Hospital. World-class healthcare for women close to home.
Hello and welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Christian Moises. St. Tammany Parish Hospital prides itself on being a leader in women and children's health care, and we have three guests on today's show to talk about three distinct topics that help us fulfill that mission of providing world-class women and children's health care close to home. Our first guest, we're happy to have her here, is Dr. Katherine Williams, an obstetrics and gynecology physician with the Center for Women's Health in Covington.
Yes.
So glad you could be here today.
Thank you for having me.
Tell me a little bit about what you do with the clinic.
Right. I am an OBGYN and founder of Center for Women's Health. We are a group of women that take care of women in all ages for their gynecologic and obstetric problems. Also, I am a certified robotic surgeon, and I have been doing robotic surgery since about 2005. I've completed over 600 robotic cases. Robotic surgery is minimally invasive surgery available to patients that are often difficult surgeries, and you can accomplish them with little blood loss and few complications. And then the last thing is I've completed my fellowship training in sexual medicine, and I have opened a clinic called the Southern Institute for Women's Sexual Health, where I take care of women with sexual dysfunction, whether it is from pelvic pain, endometriosis, also vulvar disorders such as lichen sclerosis, where they're not able to have intercourse, as well as pain caused by hormonal issues caused by breast cancer or menopause.
So you cover it all.
Yes, I do.
And menopause is actually one of the things we were going to talk about today. And I know aging, with aging comes lots of changes, and especially for women, a large part of that revolves around menopause. So I know hormone therapy is something that you focus on a lot with your patients.
I do.
Let's talk a little bit about menopause to begin with, though, and estrogen deficiencies and estrogen withdrawal. I know there's a little bit of a difference that you wanted to walk through.
Right. Many patients come into my office and they will say, having hot flashes, or they're just starting. The average age of menopause is 51 plus or minus 7, and when somebody starts losing their estrogen, they can have this roller coaster ride of estrogen withdrawal. The symptoms include hot flashes, night sweats, palpitations, headaches, sleeplessness, mood swings, and fatigue. Over a period of time, which we initially thought it was just a couple of years, but this can last a few years, those symptoms will subside. After they're gone, though, that is when estrogen deficiency symptoms set in. Now, these do not go away. These are symptoms that develop because there is no more estrogen in the body. Women start experiencing vaginal dryness. The vagina loses its elasticity, which can cause pain with intercourse. They also have changes in the brain, which can affect cognitive function. Women will say, I can't remember this, or I can't remember where I put my keys. It happens all the time. Bone loss, which can lead to osteoporosis, as well as skin changes, a loss of elasticity. Changes in the blood vessels, where they can start getting plaques in their arteries. Changes in their mucous membranes, where they can become dry. And then joint pain, and of course the genitalia changes, shortening of the vagina and narrowing of it as well.
And again, these are not uncommon things. This is part of the aging process, but there are things that can help mitigate those issues.
Yes, there are. A lot of women will come in and say, I can handle the withdrawal symptoms, but then they come in 2 years later saying, oh, I can't handle the deficiency symptoms. The sad thing is that women who decline hormone therapy during the withdrawal symptoms and then come back and beg for it in the deficiency symptoms, those are the women that are risk for heart disease. There is a lot of misinformation that was put out with the WHI and the media saying don't do hormones, they're dangerous. But what they did find in later evaluation of the study was that women who got on hormone therapy from the very beginning of menopause with the withdrawal symptoms, they stayed on it, they actually had a reduction in heart disease. So that all those fears, I think you need to talk to your doctor and make sure you find out what is best for you.
And you're getting the specific correct information.
So yes.
What are some of the hormone therapies? I know you kind of wanted to run through some of those.
Yeah, for some, hormone therapy is the best option because it will take care of just about everything that I've listed. So if somebody comes in with all the symptoms, that clearly may be the best choice for them. And to discuss with your doctor your specific risks, such as, if you have a family history of breast cancer, is hormone therapy a good option for you? Again, you want to make sure you see somebody who understands the studies. The WHI saw an increased risk in breast cancer in women who took estrogen and progesterone together, and it was a synthetic progesterone, but women who took estrogen alone had no increased risk. So that may be an option. There also was a subsequent study that looked at a natural progesterone called micronized progesterone, Prometrium, and they did not have an increased risk of breast cancer in a French study that was published in 2002.
So a lot of information.
Yeah, and also there's also non-hormonal options like SSRIs, which an example would be Celexa, and a new one on the market called Asfina. So again, many options that your provider could offer you.
And we talk about this with every guest we have on the show. Have the conversation with your physician.
Yes, absolutely.
Don't be afraid. That's what y'all are there for. Y'all are there to help your patients and just have that conversation to find out what the best course of action is going to be.
Yes.
Now, I know you talk a lot about staying the course when you're going through hormone therapy or when you're experiencing these symptoms. What exactly do you mean by staying the course?
Right. There's a lot of misinformation out there. And I want to make sure that patients get the right information because they deserve the best quality of life. Menopause, a lot of women fear it. They think that it is a change that they dread, when in fact it should be liberating. I mean, many women, the kids have moved out, and now they have the time and the space to have intimacy with their partner. So please consult your doctor, get the right information so you can have the best quality of life. This is a wonderful transition that can be, that they should enjoy and feel the freedom to enjoy.
And we talk about making sure your health is a priority.
Absolutely. Many women pay more attention and time taking care of their children and their husband, and they neglect themselves. So please realize that you have to take care of yourself, and you have to be in the best mental capacity, physical capacity, so you can continue to care for your family.
Right. And those are, again, those are common things that happen with the aging process. It's not something to be embarrassed about or something to be concerned about. There is the treatment available and things to get you through that. A question as a man, how do you help the men deal with that? What would you say to a husband to be encouraging or supportive?
I would tell the husbands, please be understanding, because if you see that your wife is particularly short or moody, talk to her about it. Ask her, do you think maybe this is menopause? And support her, encourage her to seek help and to get some advice from her doctor. And I want to also state it's very important to get advice from a physician that knows the facts. There is a lot of misinformation out there, a lot of testing and medications that aren't proven, and so you want to know about proven medications that are going to be the safest for her and that are going to give her the best results.
Right, and I asked that question, I'm sure, because you probably get it from your patients that say, my husband just doesn't get it. Yes. How do I get him to understand what we need to have happen?
Yes.
So, well, Dr. Williams, thank you so much for being here. Lots of great information, really appreciate it. And when we return, we'll be focused on the pregnancy process and period of purple crying and why it's important to go the full 40 weeks, mouthful there. We'll see you when we return.
Now that St. Tammany Parish Hospital and Auctioner are working together, advanced pediatric specialists can treat your child's most complex conditions close to home, giving you the peace of mind that comes with knowing your kids are in good hands.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Like menopause, Pregnancy brings many changes for a woman. While a scheduled or induced delivery may seem more convenient, Sharon Moore, clinical coordinator for labor and delivery at St. Tammany Parish Hospital's New Family Center, is here today to talk about why the hospital is encouraging women to go the full 40 weeks. Sharon, thanks so much for being here.
Thanks.
Always a treat to have you. Let's talk a little bit exactly what the Go the Full 40 campaign is.
It's a campaign for pregnant women to go the full 40. In the very beginning, right when you find out you're pregnant, they count your weeks, and your due date is 40 weeks. That's when you're due, kind of like when you're baking a cake. It says to bake for 25 minutes. You don't take it out earlier than that. So it's just like baking a cake. 40 weeks is your due date, and we want to encourage women to go the full 40. There may be some reasons that they can't go the full 40 for, high blood pressure, or the baby's getting too big, or they just go into natural labor, and that's okay. But we encourage patients to go the full 40 weeks.
Now, there's health benefits for the mother and the baby too. Let's talk a little bit about what the health benefits for the mother are about going the full length.
So if you're not ready for labor and you're trying to put yourself into labor with medications, your body might not respond to the medications like they should. So you have a high risk of C-section. You have a higher risk of, a longer labor. You could have, if you're in labor longer, then your water is going to be broken for longer, and that's a higher risk of infection. And getting back to the surgery, if you have to have a cesarean section because your body didn't go into labor with the induced medication, you have a higher risk of infection, higher risk of hemorrhage. You're in the hospital longer. C-section patients have to stay in the hospital for up to 4 days. If you have a natural delivery, you can go home after 1 day, 24 hours, and be back home and have your visitors over and not have to worry about, visiting hours and nurses coming in the middle of the night. And exactly.
And that was, we were just talking with Dr. Williams about menopause, that it's a natural progression for the body. Same thing with pregnancy and natural labor.
Exactly.
You want to let your body work its course.
Your body works its course, and first you feel like your hips are widening and the baby's going lower, and then you start the contractions, and your body goes through a huge course just to get ready for labor. And if you stop it in the middle, your body won't be ready for that. And
we say go the full 40, but you might go 41. You might go 42.
Exactly.
It's basically listening to your body.
When your due date is set, it's plus or minus 1 to 2 weeks, depending on when you got your first ultrasound, because like women know, we don't have exactly 28-day cycles, and it totally depends on when you ovulated, and it depends on a lot of factors. So they could be off 1 or 2 weeks.
Right. And going the full 40 is important for the baby too, probably more important for the baby than it is the mother. And what are some of those reasons for the baby?
Absolutely. So I know I've been over here before talking about the 39-week initiative, and we said we don't want elective deliveries before 39 weeks. Well, this is not changing that. We still want the babies to go at least 39 weeks because we know that is full term, and that we know that the babies are safe at that point. Going full 40 is specifically for the mom, but still for the baby. Every week counts. So if you deliver early, you could have a higher risk. The baby could have a higher risk of jaundice, of not being able to stabilize the body temperature. They could have problems with sugars. They're low sugars, and having to go and get an IV drip in the NICU. So that's not fun. And then they also have problems with breathing, and so those little lungs that's the last to develop, and just 2 weeks prior to 40 weeks they could have breathing problems. The lungs aren't fully developed, and so those are the risks involved with that. And really every week counts, and that's what we try, not just for the baby but for the mom as well.
And that's why a big reason St. Tammany is moving to the encouraging moms to go the full 40, because studies have shown, lower rates in the NICU, shorter stays in the hospital, babies are ready to come out when they're ready to come out.
And a lower C-section rate. And we really just want those moms to be able to recover faster. You're looking at an abdominal surgery, and most of the women, you're looking at 20-year-olds, they don't have surgeries then,
Right.
unless it's like, appendicitis or something, they have to have their appendix out. But I remember when I went in, I never had an IV before. So, so it's, and they're going to be having a major abdominal surgery. So we're trying to prevent that and really trying to encourage these women to stand up for what they want and what they feel is they can do. And so instead of their families pushing them, oh well, you should deliver this date and let's schedule this, really just saying, let me listen to my body, and go into that natural labor process.
As we say with every guest, of course, on our shows, it's always important to have that conversation with your physician. Don't be afraid
Exactly.
to ask the questions and have the frank conversation.
Exactly.
Your health is a priority. We want to shift a little course here. We want to go to the period of purple crying, which I know is something else that that the New Family Center is really working with new parents on. Explain exactly what the period of purple crying is.
So that's a mouthful too, not just to go the full 40, right? But period of purple crying is a program brought on by the National Center of Shaken Baby Syndrome. It's very unique, and it doesn't just tell you not to shake your baby. We laugh about it, but it's it could be a major problem, especially when you hear the baby crying for over 2 hours, and there's nothing really you can do. So what the program does is focus on child education and development education, specifically just infant crying, normal infant crying. When is it normal for the infant to cry, and when does it peak, and what are the characteristics that are all normal, that aren't associated with colic or aren't associated with the baby not eating right or not getting enough to eat. So that's what the period of purple crying is about. And the reason that they targeted the crying is because that is shown to be the #1 stimulus of shaking babies.
And we say purple crying, they do turn bright red and almost shades of purple, but purple actually isn't about the color, it's an acronym.
That's right. So purple is the acronym. P is, in purple, is it's peak. And so it is the peak of crying. The crying actually starts at 2 weeks of age, but it goes on to 3 to 4 months. But the peak is 2 months. So P is the peak of crying. U is unexpected. It comes and goes unexpectedly for no apparent reason. The R is it resists soothing. So whatever you do, whether you're holding the baby, or you're giving the baby a binky, or you're riding around in the car seat, because babies sometimes love to go in the car seat and just ride around, it does not resist soothing. The other P in purple is pain-like face. The infants may look like they are in pain, but they're not. The L is long-lasting. Like I said, it could go up to 2 hours. And E is evening. So evening crying is more prevalent in the crying.
I don't know when we've talked about this before, have patience. This is, again, part of the process. They're going to outgrow it. You've done nothing wrong. Just stay the course.
Exactly. And our nurses have gone through online training to be able to educate these moms what to do in this kind of situation. What is period of purple crying, and what is normal infant crying. And all of our nurses have gone through the training so they can educate the moms prior to discharge. We also give them a video to watch. It's 10 minutes. And I keep on saying parents, but it's really for all caregivers, because you have the babysitters at home, you have the grandparents, you might have the boyfriend of the mom, and unfortunately it is men that are shown to shake the baby just because they have tempers and they don't know how to control it, and maybe they weren't educated on it. So the 10-minute video is for them to know that it's normal, and also to know how to soothe and step away. The best thing maybe is to put the baby in a safe place and to step away.
And we got some great programs at the hospital. We have prepared childbirth. forth and using Lamaze for the Go the Full 40 campaign. We got bringing up baby classes. We got newborn, and we got tons of classes. So I hope people will go on to our calendar at stph.org, check those out. Most of them are free, if not all of them. Some great information, great resources. So Sharon, thanks so much for being here today.
Thank you for having me.
When we return, we'll visit with Dr. Patricia Brawley to talk about cervical cancer and just how preventable it can be.
For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. We are all about women's health today, which is why we're joined now by Dr. Patricia Brawley, a gynecologic oncologist with Women's Cancer Care in Covington, to talk about how easy it is to avoid cervical cancer, not just treat, but avoid and prevent. Dr. Brawley, you mentioned that cervical cancer is easy to prevent, yet 50% of women do not get the pap smear that is so crucial in preventing that type of cancer. Let's talk a little bit about how important it is to take that preventative measure.
Absolutely. Before pap smears were introduced in the United States in the 1940s and 50s, cervical cancer was the #1 cause of cancer deaths in women in the United States. With the introduction of pap smears, both the incidence and mortality of cervical cancer has decreased by at least 75%. So pap smears are designed not to pick up cervical cancer, they're designed to pick up precancerous conditions that, if they're treated appropriately, then prevent the cancer from even developing. So we don't have to then talk about radical surgery or radiation and chemotherapy. We can do a minor procedure such as laser or freezing, or a procedure like that to actually prevent or take out and treat the abnormal cells, but they're cells that have not yet developed into cancer.
And one of the things you talked before we went on air was about the vaccine and how important that can be.
Yes, the vaccine was actually introduced in 2006, and it prevented infection by 4 of the most common HPV types, 2 that cause warts and 2 that cause cancer. Just recently, in the last 6 months, a newer vaccine has come out that actually prevents infection with 9 types of HPV, 7 of the high-risk types and the 2 low-risk types that cause warts. So what that means is if we vaccinate our children appropriately, both men and boys and girls, but if we vaccinate our young daughters, we actually prevent 90% of cervical cancer, because those 7 HPV types are responsible for 90% of cancers.
So again, this is really, it is avoidable. It's not, you were comparing before about mammographies and colon cancer. You know, the difference in the two, you can get this before it even becomes an issue. Right.
And the sad thing, like you mentioned, is that pap smears are very, very good. They're not perfect, but they're very good. But so many women don't avail themselves of pap smears. A typical scenario is somebody is pretty good at going to the gynecologist, and then they get they have their last baby, maybe have a tubal ligation, or they don't need birth control, so they don't go to the gynecologist anymore, and 5 years later, 10 years later, they begin having symptoms. And once you have a symptom of cervical cancer, it's often very advanced, and then it's hard to treat. And the sad statistic is that in the last 30 years, we've not improved the survival from cervical cancer. It's still about 70%, 68, 70% of women with cervical cancer can be cured. But we've not made progress in treating it. But there's certainly been progress in preventing it if women will avail themselves of that.
Right, and that goes back to, again, like we've been saying all this show, make your health a priority.
Yes, absolutely.
And a key to that is knowing some of the signs and symptoms and some of the risk factors. So if we could run through those real quick, just to let people know what to look for.
Sure. The risk factors for cervical cancer, the number one risk factor is having a virus called human papillomavirus. And HPV is the virus that the vaccine was developed against. So ideally we give the vaccine prior to any exposure to HPV. That means prior to onset of sexual activity. And so the recommendation is that all 11 and 12-year-olds get vaccinated. But so HPV is not only important, it's really necessary to develop cervical cancer. 99.7% of all cervical cancers have been shown to have HPV, are caused by HPV infection. So HPV is the number one risk factor. That is then associated with early onset of sexual activity, and that's defined as becoming sexually active before the age of 18, which is not really considered all that early these days, but if a young girl becomes sexually active prior to her 18th birthday, her risk of developing cervical cancer is more than double that if she waits until she's 21 or older to become sexually active. Another risk factor is having multiple partners, and multiple partners doesn't mean being a prostitute out on the street. If you have more than 2 lifetime partners, that increases your risk significantly, maybe even triples your risk of developing cervical cancer. Another important risk factor is smoking. Smoking seems to do something in conjunction with the HPV virus. I'd say it makes it mad. It does something that increases the risk of developing cervical cancer. And then if you continue smoking once you have cervical cancer, your risk of having the cancer recurring and you dying of it is higher. So stopping smoking is very important also.
I know there's some other things, contraceptive pills,
right.
Other STDs,
yes.
Genetic alterations.
Yes, having any other sexually transmitted disease, whether that's herpes or chlamydia or gonorrhea, those increase the risk. And there's some data that actually having herpes and having HPV makes the HPV more virulent. So there may be something about the immune system or something that allows the HPV to become more aggressive. Certainly immunocompromised state is also important. So women who, for example, are on high-dose steroids for bad asthma, or women who've had a kidney transplant, or women who are HIV positive, anything that has an impact on your immune system actually increases the risk of developing cervical cancer.
Now, let's just say, talk about signs and symptoms, briefly.
Sure. Somebody
who's not getting a pap smear but maybe watching this show and may have some of these risk factors they're concerned. Is there anything that they can see right now that may be an indication?
Yes. The 2 symptoms that I would say are the most typical. Unfortunately, these aren't with real early cervical cancer, but hopefully still when it's at a stage when it's curable, would be bleeding after intercourse. And that's probably related to the cervix is fragile. It has a lesion on it that is traumatized by intercourse, and so we call it postcoital bleeding is a risk or is a symptom. Another one is a watery vaginal discharge that can be fairly significant, and if that's persistent, it certainly could be just a vaginal infection, but it also could be one of the signs of cervical cancer. More advanced cancers can be associated with pain, typically pain in the abdomen or pelvis, maybe radiating down the back of their leg like sciatic pain. That's a risk factor. A symptom. Having one swollen leg also is a sign of cervical cancer.
So lots of tips, lots of signs.
Yes.
Get you into your office. Make your health a priority.
Absolutely.
Read up, ask the questions, know what's going on.
Yes.
Dr. Brawley, thanks so much for being here. Lots of great information. Really happy to have you with us today.
Thank you. It was my
And
pleasure.
remember, you can always find out about these and more health issues on our website at stph.org. And make sure you follow us on our social media accounts, Facebook, LinkedIn, Twitter, where we post a lot of tips on issues such as these and others. Until next time, have a great one.
For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.